I'm a Nuka Fellow at Southcentral Foundation, and I'm doing various quality improvement projects this year. So some of them have been more focused in the rural areas, including to help the transition of clinics in the Lake Iliamna region to Southcentral Foundation management, as well as starting a brand new clinic in Port Allsworth. It was exciting because that is a community that's never had local access to healthcare, and we were able to facilitate that. The other projects I've done that have been Anchorage-based have been in the pediatric department. We've worked on inpatient pediatrics doing a redesign of their staffing model, as well as on outpatient pediatrics, re-examining their RN case management roles and reassessing how we define the needs for those areas. So working at Southcentral Foundation this year, I've really been able to understand what do we need to know to be able to deliver care effectively, efficiently, in a cost-effective way, and then also in a culturally sensitive way. And that's been really impactful in the way that I hope to practice medicine in the future. I think in medical school we're always taught to be patient-centered, but what I realized working here is that we often really are physician-centered. We're saying, what schedule works for me? This isn't convenient for me. This helps my billing if you come at this time, or if we bill a visit in this way, instead of really being focused on what is best for what we call a patient, but at Southcentral Foundation we call the customer owner. And so that really challenged my way of thinking and reframed how I think we should all work in the culture of medicine and be adaptable to all the cultures that we're working with as providers. Good. An experience like this is really unique. In medical school, we don't have the opportunity or really the time to think about things on a system level. There's often the common saying that it's like drinking from a fire hose with all the information that we're trying to learn. And so I think it's really important to have had this time away from the clinical setting to learn about all these different aspects of delivery of care, healthcare quality, systems, and teamwork. So what it's like to be a fellow in Alaska, it's been very exciting. So I'm a person who loves the outdoors, and living in Anchorage, it's been so easy to go out and hike all year round. I'm in the mountains within 20 minutes. There's also a great community of hikers, so it's been very easy to meet new people and go out and hike. The winters I was a little bit nervous about. Being from Seattle, I'd never experienced a really cold winter, and it really wasn't as bad as I expected. The darkness wasn't too bad because when it is light out, the sun was shining, so we were still able to go out and adventure in the outdoors. Anchorage also has a great food scene, surprisingly, and as a foodie, I've really enjoyed exploring all the different restaurants and trying the various types of food here. An experience like this has really changed the way that I hope to practice medicine, and I believe it's also prepared me to help be a leader in these changes in healthcare.